Hey Joanne, how are you? Hey guys, hi Facebook, this is 𝘿𝙧 Performance Plus Physical Therapy. This is my continuation of my series Q&A with Dr. D. I am answering the questions that I'll get a lot from my patients. And hey honey, how are you? And this is an opportunity for me to give you guys a little bit more information, but also for you guys to ask your own questions if you have questions about the topic at hand. Today we are discussing ankle braces. Now, this is an interesting one. Yesterday I talked about ankle sprains, and I thought it would be a great segue to talk about ankle braces. Here's the deal. Depending on the practitioner and their train of thought, you're going to probably get different answers about how to use an ankle brace, when to use an ankle brace, how long do you use an ankle brace for. It just depends on the thought process of that practitioner and their training and their bias. So I want to put out the disclaimer here that the information you're going to get today, I'm going to give you a little bit of what the gold standard is in the industry, but I'm also going to tell you what my bias is on my thought process in terms of the use of ankle braces, how it is helpful for you, and when you should use it, when you should not use it. Specifically for athletic populations, for people who are very active on their feet, football players, basketball players, dancers, swimmers, any of that, those people who are very used to moving. Once you get into an injury where you have a sprain or a strain of a muscle, sometimes you may need the use of a brace. When we're talking specifically at the ankle, usually that's indicated if you've had a moderate ankle sprain. So not a grade 1, which means that you're you kind of tweaked your ankle, you rolled over it a little bit, and then in a couple of days it's fine. We're not talking about that. We're talking about the ankle sprains where it's a little bit more involved, where you do have significant issues. You have swelling, you have pain, difficulty walking, difficulty with your motion, moving your ankle around, with your stability, with your balance, with your strength. We are talking about those, okay? So when we're talking about those, there is a train of thought. Sorry about that, IG. Got a call. There's a train of thought that you need an ankle brace, and I completely agree with that in the acute phase of the injury. Acute meaning it just happened, you're in a lot of pain, it's difficult for you to walk, you need stability. The purpose for ankle braces is to really provide some sort of external support when you're lacking that support on your own for some reason, because of pain, because of swelling, because you've torn a ligament and you're not physically able to provide that stability on your own. Okay, that in my mind is when you should use an ankle brace. Now, the deviation in how different practitioners use ankle braces depends on how long. How long is it that I should use an ankle brace for? And I get this question so many times. So from my standpoint, the second that you are out of acute pain and that you can stabilize on your own is exactly when you should get rid of that ankle brace. The reason for that is the ankle brace is a means to an end. The end point is for you to regain your stability, for you to regain your strength, for you to decrease your pain so that you can move around on your own. When your ankle brace becomes the end point versus you going past that, that's when you start getting into trouble. That's when you start getting into difficulty. And you start physically depending on the ankle brace to provide that stability, to provide that strength and that neuromuscular control that you should be doing yourself as you go through your rehab process and as you are healing. So I always tell a lot of dancers, and this applies to ankle braces, applies to knee braces also. I always tell a lot of my my dancers, hey Taurus, we need to talk. I think I missed your class, so I want to know if you have another class, but we'll talk about that. So I always tell a lot of my dancers, if you've seen a dancer that's on a knee brace, you've never seen them without it. And that's because they've started to get dependent on using that ankle brace or using that knee brace in order for you to really stabilize and do what they need to do. So Joanne is giving me a question. What do you consider acute? What's your time frame usually? So with acute, Joanne, acute means it just happened. In the PT world, in the medical world, we're talking 1 to 2 weeks. Anything past, once you start getting past 2 weeks, you're starting to get into that subacute phase. Chronic is when you start getting past 3 months. So that's what I consider acute. So acute, guys, really means that it just happened. You just rolled over your ankle. You're having a lot of pain. You're having a lot of swelling. You're having a lot of changes in the range of motion. Okay? Taurus says, you look, thank you, honey. You're so sweet. Making me blush. Hey, TJ, hope everything is well. We need to catch up too. All right, so I hope that answers your question, Jay. Joanne, yes, it does answer your question. Great. All right, so guys, just a little bit of an overview of what we talked about today. Again, ankle braces. What do you do with ankle braces? Do you need them? Yes. Are they functional for you if you've had an ankle injury? Absolutely. They can provide very vital stability, very vital protection once you've had an acute injury. Do you keep them on forever? My 2 cents, absolutely not. I very much push my patients to get rid of external braces as soon as possible. The sooner that you can start telling your muscles to work and to fire and to stabilize on their own, the better. Unless, of course, there is some sort of contraindication, meaning that you've completely torn a ligament or you've completely torn a muscle and you actually have no physical stability and you need external support. In which case, you're probably looking at some sort of surgical intervention anyway, and the ankle brace in any case is temporary. But the moral of the story today, guys, that I really want you guys to take away from this is that definitely use the tools that you need or you have at your disposal to make sure that you're moving and you're functional as possible, but do not rely on those tools in order to maintain your function. That is very important. So start using the ankle brace, but try to get away from it as soon as you possibly can. It will benefit you in terms of your entire rehab process and making sure that you're getting back to your full 100% of where you were before your injury. Okay, so that's what I have today, guys, in terms of ankle braces. Do we have any other questions? Any questions, guys, on Facebook? Any questions? Jay, you have any more questions? I'm thinking not. If you do, guys, if you do have any other questions or any additional questions about ankle braces or any other questions that you want to talk about, this series is going to go on for quite a while. I'm going to be talking about different things, different body parts, because I do get quite a bit of questions. Hey, how are you? Hope everything is well. Thank you for joining. If you do get any additional questions, please feel free to shoot me a message or private message me if it's of a private nature. I'm happy to answer your questions or address it in a setting like this if that's something that you're comfortable with. So hope everyone is well. It is Wednesday, I think. I'm losing track of time all the time. I think it's Wednesday. But yeah, I hope everything is well. Oh, we have one more question. Any brace bands that any brands that I prefer? Not really. In terms of braces, I'm not particularly sold on one brand of a brace. I go more for the type of support that needs to happen. So for example, if someone needs to be completely immobilized, it needs to be something that allows them to be functional, but then allows the support in the right way. So for example, if they've had a grade 2 sprain and they've had quite a bit of tears to the ATFL, which is the ligament on the outside of the ankle in terms of ankle sprains, I would recommend that person get an ankle brace that has a heel cutout, so there's a little bit of mobility and a little bit of there's not so much of a limitation through that entire ankle joint, but make sure that they get something with metal struts on either side that makes sure that it stabilizes the medial lateral motion of the ankle, which is what's compromised when you've had that tear. If it is that they need just a little bit of external support and sometimes compression, I would go for a neoprene sleeve. Again, the brand is not important to me. That's the one with the ankle cutout. There are no metal struts on the side, and they can just easily slip it on and slip it off. That's usually the go-to for something that's a little bit more tactile, a little bit more feedback, but not as firm in terms of rigid support. So that's what I would go with, Joanne. I hope that answered your question. I'm not a huge brand person. I'm a big function person. So if it works, that's what I'm going with, and that's probably where you'll get my brand loyalty in there. Sounds good. So is my preferences as well. Yes. All right. Any other questions, guys, before I hop off here? Again, shoot me your comments, your questions. Happy to answer any questions that you guys may have. Okay. Hope you guys have a wonderful day. See you tomorrow. We'll be talking about something else. I'm making this up as I go along, guys. So give me ideas, give me feedback of what you want me to talk about. But we'll be talking about something else tomorrow. I'll definitely post it in my IG feed, Facebook. You should see that in my Performance Plus Physical Therapy feed. You'll see that also. All right. Have a great day, guys. Bye.